Let's talk about COVID-19. The NDC set up a COVID-19 team.
Yeah.
Are you impressed with the work that they've done so far?
Sure, I'm very impressed.
What difference have they made?
Oh, they have come up with, in fact, if you are assessing anybody, you assess that person based on the assignment you've given and measure and see how much of the objectives have been achieved. And so the objective of NDC setting up that committee was to respond to the call by His Excellency the President that we are in a very difficult situation, so all hands must be on deck. We are fighting an invisible enemy, so we must pool all our resources together as a nation to be able to fight that enemy. So we are in a position, we don't control government resources, we can only control our own individual resources. And so, but we have people who have knowledge and expertise in fighting in such diseases or dealing with such situations. So we decided that let us put a team together who will also be doing work and then be looking at best practices elsewhere and putting together memos to be advising the government team as to how best to handle certain things.
So that's what the team has been doing?
Yes, and they've done it very well. Because so far they've submitted about 3 different papers. They've made a lot of suggestions.
Is it what they do in the press briefings? Is it when you say they presented memos? Is it privately to governments?
Written memos with recommendations and all that.
Directly to government?
Directly to government.
Okay.
So they've presented some of them.
How many have you presented so far?
One was even presented to His Excellency the President himself when there was an occasion where he invited leadership of political parties. Our national chairman presented one.
So what have they done with those suggestions? Those recommendations?
A lot of the suggestions have been taken on board. A lot of them have been taken on board. And then there are others too which have been taken on board partially, and there are others which have not been dealt with at all.
There are those who criticize your party and your flag bearer, John Dramani Mahama, for taking advantage of the current situation and holding press briefings and giving out PPEs sometimes. So basically just playing political game with what is happening.
Why? You don't understand the meaning of the president calling everybody to come on board for us to fight. And if you have any means of helping that call, you mean that the better way to be a good citizen and a good statesman is for President Mahama to have folded his hands, stayed in his corner, and said, it is the government that is in power, let them do it and let's see the outcome. Do you think that that would have been a better response as a responsible state person? I don't think so. So those who hold that opinion, let them continue holding that opinion. We believe in our opinions, and we believe that we undertook the best of actions. One area that we had cause to complain about was that we didn't see emphasis being placed on protecting the frontline staff to be able to help us fight the disease, because every war has its generals. So if it were to be a military warfare, we'll be talking about weapons and ammunition and other things for soldiers. Now we are not in that type of war. We are in a health war. So the frontline staff must be our priority, because you protect them first so that you position them to protect the rest of us. So if their protection is not prioritized, and they are also capable of being killed, then the little protection they have, they'll reserve it for themselves, and they will not go to undertake the type of risk that will put them in harm's way. Because doctors and nurses are not immune to the disease by virtue of their training, only by virtue of their training. They may be, very knowledgeable in this, knowledgeable in that one. Why? Having doctors died, the last time I heard, I heard some figure of about 13 medical staff having challenges and so on. And I know one prominent...
in Ghana? You mean 13 medical doctors have died in Ghana?
No, not died. I say challenges. I mean positively tested. But at least I've heard of one professor at Kolebu who we painfully lost. This is a repository of medical knowledge, and it will take a long time for us to replace.
Well, we have quite a number of nurses and midwives confirmed by the council who have tested positive, and one person has died.
So I'm saying that the thing you ought to do is to emphasize on their protection and their safety first.
But we've made a lot of progress, would you agree?
They can save others.
We've made a lot of progress. We're not where we used to be. Even in terms of the PPEs.
That is true, but we are not there yet. We could have made better progress if we had been listening to Punch earlier on. Now, even as we speak now, when the president comes to address the nation, he talks about, first of all, they were lumping the testing figures and the positive figures together so nobody can follow the trend. We made a lot of noise, and luckily for us, they've listened. We are now having daily testing results and so on. So you are able to monitor the progress of the disease, which is commendable. But again, we said that these PPEs, they are consumables. Okay. So it doesn't make any sense for government to just come and tell us that we have imported so many thousands of facial masks, we have brought so many millions of this, so many thousands of this, without relating it to our requirements. Because to communicate and put our minds at ease, you should be able to tell us that if it is about facial masks to the frontline staff, what is our national requirement for facial masks at our various health facilities? If it is 1 million or 300,000 per day or per month or per whatever period, and then government tells us that out of this we are able to meet 20%, 30% or so, then we know we are making progress. But things that are consumables, and you come and you are communicating in numbers, absolute numbers, without relating it to the user rate and so on, and immediately after every presentation, you hear health workers in facilities complaining that they don't have those things. Is it that the numbers we have been told are lower than what is required? And if so, what percentage are we satisfying and what percentage are we not satisfying? And then the figures they are mentioning, they are consumables. So if you say that I have imported 1 million facial masks, and every day, we don't know, we use 100,000. So your 1 million lasts for 10 days. Nobody will be able to make sense in what you are communicating.
I see where you're coming with that.
So that is why we feel that wherever we are able to procure any of these materials, and we hear this hospital complaining that this is their problem, we rush there, cut all the red tapes, because even if government has to import, there's a whole world of time lag between the products hitting the warehouse who distributes them to regions, who distribute them to health facilities and so on. But the disease is not waiting.
So you're on standby, so step in when there is an
emergency. So that is what we have been doing across the country.
With your donations.
I think that, yes, and I think that it has yielded results.
Let's turn our attention to the NDC and the Electoral Commission. Of course, you've been embroiled in this protracted battle with the EC as you resist the compilation of a new register. That's obviously a battle that you know now that you can't win, because the EC has come out with some measures in compiling the new register. Are you convinced now that you've lost this battle of resisting a new register?
The battle is now beginning.
Is it?
Yes.
How is that? When the Electoral Commission is giving us measures to keep people safe whilst they register?
It's not about their might or what their capabilities, their power, and so on. If that is what you assess when you are fighting wrongdoing, then you better take a look at what happened in the fight against apartheid. The apartheid government had nuclear weapons. The apartheid government had nuclear weapons. Mandela didn't have any weapon. He spoke. And eventually, the apartheid system did what they could. In the end, they had to eat a humble pie.
So what are you prepared to do?
And accept
what else are you prepared to do to get the EC to back down?
And accept the fact that people who are determined to seek justice take advantage of their God-given rights cannot be suppressed by any power on earth.
What else are you prepared to do as a party?
The fight is going to be a long fight. We are in for a long fight because we believe that what Electoral Commission is trying to do will not serve this democracy well. And we are placed in a position of privilege to know. So it is our responsibility to communicate to the other Ghanaians who may not know, and because of that they have been hoodwinked into believing that what they are doing is right, when in actual fact they are doing wrong things.
So I ask again, what are you prepared to do? What else are you prepared to do to get the EC to back down?
Part of it is what I'm doing here with you. This is a big platform. We are fighting with facts and figures. And the ordinary Ghanaian is a discerning Ghanaian, discerning human being. When they realize the truth about a situation, they will go for the truth. So that is what we are doing. And that is why we have done through press conferences, analyzed figures given by them and exposing the petty hypocrisies involved, deceptions and lies here and there, so that the Ghanaians take that story, they should listen to Electoral Commission and see who is serving the ends of democracy in this country.